Hi, we are Beth and Courtney from the Advanced Hospice team. Understanding that it can be difficult to determine when your patient might be ready for palliative or hospice care, we wanted to share some guidelines which we're hoping you'll find beneficial.
Palliative care and hospice care have some similarities, but they do differ in focus and approach. But when do you know it's time to transition? We look for the signs: increased falls, increased pain, more dependent on ADLs, frequent hospitalization. These are all indications that it may be time to increase the need in the care in the home.
So, does your patient need palliative care or do they need hospice care?
Okay, we're going to start with palliative care. Beth?
So, palliative care is for chronic or terminal illnesses when life-prolonging treatments are still being active or sought. The palliative care falls under home health care, which means that it's also dependent upon insurance authorization, dictating the number of visits that can be made and what disciplines can be in the home. Staffing for palliative patients includes the addition of a palliative nurse from the hospice team who alternates visits with the home health clinician.
The palliative nurse focuses on clinical changes such as symptoms and disease progression and monitors when, if or when, it's appropriate to transition to hospice. Palliative care is sometimes viewed as a bridge from aggressive treatment to comfort care and leading into hospice. Okay, Beth, now let's talk about hospice.
Hospice care is a multidisciplinary approach focusing on the patients physically, psychosocially, and spiritually. Hospice is a program through Medicare, available to patients of all ages with a life-limiting illness who want to focus on quality of life and living. These folks generally are not seeking aggressive treatment and they want to focus on quality of life and living despite their terminal disease. The hospice team determines the frequency of visits while managing symptoms with the goals of comfort, mobility, and dignity. Patients on hospice are not seeking medical interventions or aggressive treatments, but rather are just acknowledging that they are living with a terminal disease.
If there is one piece of advice that we could share with you, is to take the focus away from the prognosis and place it on the person themselves, what their needs are, and the life that is left within them. Referring your patients to palliative and hospice is a kind gesture and recognizing that they are just in a different need of level of care, and we can provide greater benefits that way.
It's really not about giving up on people. That's oftentimes what patients feel and also what clinicians feel when they're transitioning patients to hospice care. We recognize that despite having a terminal disease, people have great value and they have purpose in life and they should be able to live that purpose out. Hospice care is about care, support, inspiration, peace, and yes, even living.
Especially living. So for more information on benefits for palliative and hospice or any other questions, please don't ever hesitate to call us. Our number is 412-710-7300, and you can also visit our website at www.advancedhospicepa.com. Thanks, guys.
Thanks. Have a great day.